Welcome to BoxedIn Health. Today we uncover the topic of iron deficiency anemia. Iron is a crucial mineral vital for a range of bodily functions, particularly in transporting oxygen through the bloodstream, which is vital for sustaining daily energy levels. Rich sources of iron encompass red meat, organ meats, and iron-fortified breakfast cereals. The body loses iron through mechanisms like perspiration, shedding intestinal cells, and blood loss. Approximately a third of the global population grapples with insufficient iron levels, with menstruating women being more susceptible to iron deficiency compared to men and postmenopausal women. Iron plays several vital roles in the body, including oxygen transport. Hemoglobin, a complex protein found in red blood cells, carries oxygen from the lungs to the body's tissues. Hemoglobin is primarily composed of iron, accounting for about two-thirds of the body's iron content. Myoglobin, this specialized protein aids in storing oxygen within muscle cells. Myoglobin, which contains iron, contributes to the red hue of muscle tissue. Enzymes. Numerous enzymes in the body contain iron and serve important functions, particularly in energy production. Enzymes act as catalysts, accelerating chemical reactions that drive various cellular processes. Immune system support. Adequate iron is crucial for the proper functioning of the immune system, an essential component in fighting off infections. Food sources of iron. In our diets, iron comes in two forms. Heme iron. This type is present in animal tissues like beef, lamb, kangaroo, chicken, and fish. Offal products such as liver and kidney are especially rich in heme iron. However, pregnant women should be cautious about consuming too much offal due to its high vitamin A content, which can potentially cause birth defects. Heme iron is the form most easily absorbed by the body. Non-heme iron, found in both animal-based products and plant-based foods like dried beans, lentils, iron-fortified breakfast cereals, whole grains, and legumes, beans and lentils. Vegetarian sources of non-heme iron are valuable, and include dark green leafy vegetables like broccoli, raisins, nuts, prunes, dried apricots, seeds, dried beans and peas, as well as iron-fortified cereals, breads, and pastas. For vegetarians without animal tissue in their diet, nearly double the daily dietary iron may be necessary compared to non-vegetarians. Dietary factors affecting iron absorption. The way you eat and drink can influence how effectively your body absorbs iron. Here are some tips to enhance iron absorption. Incorporate vitamin C. Include fruits and vegetables in your diet to ensure good intake of vitamin C, which can boost iron absorption. Combine animal and plant proteins. Pair plant-based sources of iron, non-heme, with animal proteins, heme. For instance, you could combine meat with beans, like beef and kidney beans in a chili, to optimize iron absorption. Cook plant-based iron sources. When dealing with plant-based iron sources like vegetables, cooking them can increase the availability of non-heme iron. For example, the body absorbs around 6% of the iron from raw broccoli, but that absorption increases to about 30% when the broccoli is cooked. Certain foods and beverages can hinder your body's ability to absorb iron. Soy proteins. These can decrease absorption of iron from plant-based sources. Tannin-rich drinks. Beverages like tea, coffee, and wine contain tannins, which bind to iron and carry it out of the body, reducing iron absorption. Phytates and fibers. Found in whole grains like bran, these substances can lower the absorption of iron and other essential minerals. Inadequate vitamin A. A diet lacking sufficient vitamin A may contribute to iron deficiency since vitamin A aids in the release of stored iron. Calcium and phosphorus. These elements can diminish the absorption of plant-derived, non-heme, iron. Individuals who face an elevated risk of iron deficiency encompass infants given cow's milk or other non-breast milk substitutes. Toddlers, especially those with excessive cow's milk consumption. Adolescent girls. Women experiencing menstruation, particularly those with heavy periods. Women utilizing an IUD, due to increased likelihood of heavier periods. Pregnant and breastfeeding women. Individuals with inadequate diets, including those dependent on alcohol, adhering to fad diets, or dealing with eating disorders. Vegetarians and vegans. Aboriginal Australians. Athletes undergoing training. People with intestinal worm infestations. Individuals with predisposing conditions to bleeding, such as gum disease, stomach ulcers, polyps, or bowel cancers. Individuals with chronic illnesses like cancer, autoimmune disorders, heart failure, or renal, kidney disease. The signs and symptoms of iron deficiency anemia in children may include 1. Behavioral problems. 2. Repeat infections. 3. Loss of appetite. 4. Lethargy. 5. Breathlessness. 6. Increased sweating. 7. Strange food cravings, pica, like eating dirt. 8. Failure to grow at the expected rate. Causes of iron deficiency in adults. In adults, some of the common causes of iron deficiency include 1. Not getting enough iron in your diet, also known as inadequate dietary intake. 1. There are many reasons why someone's dietary intake of iron could be too low, for example due to a poorly balanced vegetarian diet, having limited access to a wide range of fresh foods. 2. Blood loss. Iron deficiency easily occurs in situations of chronic, ongoing, blood loss. 2. Common causes include heavy menstrual periods, regular nosebleeds, other chronic conditions that involve bleeding, such as peptic ulcers, polyps or cancers in the large intestine, and certain medications, particularly aspirin. 3. Increased need for iron. If you are pregnant or breastfeeding, your body needs more iron. 4. Exercise. Athletes are prone to iron deficiency because regular exercise increases the body's need for iron in several ways. 4. For example, hard training promotes red blood cell production, which requires iron, and iron is lost through sweating. 5. Inability to absorb iron. Healthy adults absorb about 10 to 15% of dietary iron, but some people's bodies are unable to absorb or use iron from food. Causes of iron deficiency in babies, children and young people. Major risk factors for the development of iron deficiency in children include 1. Prematurity and low birth weight. 2. Exclusive breastfeeding beyond 6 months, not introducing solids. 3. High intake of cow's milk in young children less than 2 years of age. 4. Low or no meat intake. 5. Vegetarian and vegan eating. 6. Poor diet in the second year of life. Major risk factor for iron deficiency anemia in adult include 1. People taking aspirin as a regular medication. 2. People who have a lower than normal ability to absorb or use iron, such as someone with celiac disease. 3. Gastrointestinal disease. 4. Lead poisoning. Prevention of iron deficiency anemia. To ensure toddlers and preschoolers have sufficient iron and prevent iron deficiency, consider the following. Incorporate lean red meat. Include lean red meat in their diet 3 to 4 times weekly. Additionally, provide meat alternatives like dried beans, lentils, chickpeas, canned beans, poultry, fish, eggs, and small amounts of nuts and nut pastes. These sources are vital for iron in your child's daily diet. If your family follows a vegan or vegetarian diet, consulting a dietitian is advisable to ensure all dietary needs are met. Include vitamin C. Integrate vitamin C into their meals as it enhances iron absorption. Ensure your child consumes ample vitamin C-rich foods such as oranges, lemons, mandarins, berries, kiwi fruit, tomatoes, cabbage, capsicum, and broccoli. Promote solid foods at meal times. Encourage the intake of solid foods during meals and monitor that toddlers don't fill up on drinks between meals. Manage digestive health. Chronic diarrhea can deplete iron stores in your child's body, while intestinal parasites like worms can lead to iron deficiency. Seek prompt diagnosis and treatment from a doctor if needed. Address fussy eating habits. Fussy eaters may be at risk due to poor food intake or lack of food variety. Seek guidance from a dietitian, local doctor, or child health nurse to effectively manage a fussy eater. To prevent iron deficiency in teenagers, consider these steps. Engage in conversations. Have an open dialogue with your teenager about the significance of iron in their diet. Equip them with knowledge to empower responsible food choices. Promote iron-rich foods. Encourage the consumption of iron-rich foods and meals, like iron-fortified breakfast cereals, breads, and servings of meat, poultry, or fish during dinner. Introduce non-heme iron sources. Introduce good sources of non-heme iron, such as dried beans, lentils, peas, broccoli, spinach, beans, fortified cereals, breads, and whole grains, especially if your teenager opts to limit red meat or follows a vegetarian diet. Additionally, emphasize vitamin C-rich foods, like fruits or vegetables, during meals to aid iron absorption. Limit tea and coffee. Advise moderation in the consumption of tea and coffee, as excessive intake can hinder iron absorption. Since iron supplements can be obtained without a prescription, the temptation to self-diagnose may arise. However, it's strongly advised against for the following reasons. Toxicity risk. Excessive iron in the body can be toxic and potentially fatal. Symptoms overlap. Symptoms like fatigue, paleness, dizziness, and breathlessness are common in various health conditions, not limited to iron deficiency anemia. Incorrect self-diagnosis and self-medication pose dangers and can delay crucial treatment. Timely and accurate diagnosis by a healthcare professional increases the chances of a successful recovery in the early stages of a disease. Ineffectiveness and wastefulness. Iron supplements won't alleviate symptoms if iron deficiency anemia isn't the root issue. Additionally, unnecessary consumption of iron supplements can be a waste of money and may not be suitable for you or your child. Mineral absorption interference. Taking iron supplements when not needed can interfere with the body's absorption of other essential minerals, including zinc and copper. If you like today's video, do share and subscribe. Thanks for watching.